For those of you that have been on these webinars with us, you're familiar with this slide now, but as Janae Holtz talks about sexual development and sexuality in adolescence with FASD, these three core areas are still what are driving much of what she's going to be talking about. And the three domains of neurobehavioral functioning that we see in adolescents who have been exposed prenatally to alcohol, the three key domains of functioning affected are neurocognitive functioning, which has to do with memory, executive functioning, sequencing, understanding cause and consequence. Issues of self-regulation, which is how well the individual is able to regulate behaviors, thoughts, emotions in the context of day-to-day life. And the third component is adaptive functioning, the ability to take what an individual knows and use that information in daily living. So adapting cognitive information to daily living skills. And I think as you hear Janae's presentation, you'll understand how these three domains affect sexual development and sexuality in adolescents with fetal alcohol spectrum disorders. So it is my pleasure to present our invited guest today. Janae Holtz is a friend and colleague who has been running a program, the Desert Mountain Counseling Center, out in San Bernardino, California for several years now, and working with this population of young people. Now it's my pleasure to introduce Janae Holtz.
So as we think about what Dr. Chasnoff has shared about the neurocognitive functioning and the inability that some of our kids have in making good decisions, the executive functioning is definitely impaired. And so we have to think about then how we're going to teach our children to handle things differently who may have FASD. So we do know that adolescents with FASD are concrete thinkers, and many times they lack the inhibition and the ability to think before they act. And so the cause and consequence or cause and effect consequences, children just don't understand. So when we tell them something and we expect them to get it and then to respond effectively, they don't. And so we have to be their brain for them in many ways. The other thing is that kids with FASD often do not have the ability to delay gratification, and children in general have a hard time with that. So us learning how to meet their needs, but also teach them then how to be able to delay gratification will help us as we start looking at sexuality in children with FASD. All right, so part of what we're going to talk about today is sexual development, and I think it's really important that we understand typical sexual development because all of us are sexual human beings, and we have to know the typical way of developing so that we can then help our kids who may be on the spectrum. So recent research indicates inappropriate sexual behavior is one of the most prevalent secondary disabilities of FAS. I think this is a critical finding because I think as a society we have a moral obligation to actually change that. And so part of what we have to think about is how we get the word out to people not to drink during pregnancy and that any amount of alcohol is not okay. The other part is for our children who have been diagnosed with FASD, how do we help them and how do we start as early as possible, first of all with a correct diagnosis, but then in how to actually support them and to provide the supports they need so that it does not become a secondary disability. So the sexual development occurs for children with FASD as it does with all kids. The difficult part for our kids with FASD is that the impairment to their brains increases the likelihood of the impulsive behaviors and the poor decisions. And then it makes it difficult for them to make good decisions in those situations or those moments when they don't have the support around them. So through review of the literature, we know that many children and adolescents diagnosed with FASD exhibit behaviors such as irritability and stealing, aggressive behaviors, impulsiveness, poor academics, poor decision making, and inappropriate sexual behaviors. So if we know that that happens, we know that from the research, then how do we put things in place to protect them and keep them safe? And I think that is not an easy task. I think as parents and as caregivers and as support systems, that is hard work. And the more that we provide a community of care for kids who fall on the spectrum, I think then we can help in helping them make better decisions. So I'm preaching to the choir, I believe, that you all know that our kids with FASD, they are impulsive. And most teens are impulsive. I have a 14-year-old, and I can say he is impulsive. A child with FASD is even more so. And the risk, they don't think before they act. And oftentimes they get into situations where they have offended someone or done something just awkward because they don't understand the cues that most of society and our social behavior understand. The sad part about FASD in kids is that because they don't read those cues and because they have just difficulty sometimes fitting in, that then they're drawn to things that can hurt them. And so some of their experimentation sexually may be with younger or older people. Now, experimentation for sexual development can be quite common among all, but with our kids with FASD, the hard part is they don't understand when it becomes dangerous, when it is crossing that line of inappropriateness. In addition to that, we have many of our kids with FASD that we've worked with who, once they become preteens and teens, actually become very risky and start running away and not able to find them for days. And so having things in place prior to that is one of our hopes in helping children to remain safe. So let's talk about the external brain. Dr. Chasnoff has talked about the external brain frequently. And I actually laugh when I talk about external brains because I think most teens require an external brain. But a child who has fallen on the spectrum definitely has to have external brains. And I say more than one, not only for the teen, but also for the parent or the caregiver. Building a support system around you of trusted adults and people who understand the special needs of this child can actually help to not only make better decisions for the child, but to keep the child safe. And so as a parent, it's a different way of parenting. Not all kids can be raised the same way. So a child with FASD, by providing those supports and those other people in this child's life who not only teach but guide, provide structure, and are trusted to help your child make good decisions, you have a better chance of that child being successful. And it actually can be a quite nice learning for the child to hear things other than from the parent. Because if any of you are parents, you know that when you tell your child something, sometimes they don't want to listen to you, but someone can say exactly the same thing and they have an aha moment. And so building this around our kids is important. The thing about the external brain and for children with FASD, it's not a one-time teaching opportunity. It is ongoing teaching for our children, and it's in all situations. But I think it's really important as parents to remember, and caregivers to remember, that it's not a lecture. The teaching is a conversation, and the teaching is in our everyday moments and life experiences. That helps a child to connect that memory to something instead of just talking. And the other part of talking and teaching is not just talking, it's listening. And for parents, I think sometimes we want to speak more than we want to listen. And I think that's key in hearing our kids of what they're thinking and what's new to them and what they've heard on the schoolyard and what's going on with them, so that we can actually understand better of how to apply different skills to help them be successful. And we have to repeat it over and over and over again. And I think that is one of the hardest things for caregivers of children with FASD, that we do have to repeat it over and over, and we have to repeat it kindly, and we have to repeat it genuinely. Otherwise, it becomes a battle, and we don't want the battle. It is hard enough raising children with FASD. So to take a moment for yourself as a parent and step back and be able to then come back and have the conversation again will be helpful to the child. So let's talk a little bit about typical sexual development, because I think that helps us then in how we're going to help our kids with FASD handle their sexual development. So when you look at children, infancy to 3 years old, they are already starting to understand their own sexuality. They aren't able to put it into words, but they are curious about their own bodies. They're learning about themselves. It's a great phase for children. They are learning so much during those first 3 years. As children start to learn language, we teach them the body parts, so the nose and the ears. Now, this is an interesting time to start teaching private parts, and some people use slang words. Much of the research talks about using the medical terms, but teaching children about their private parts early on is so important. And it's important for children to learn early on, as soon as they're able to grasp it at their developmental level of privacy and respect, and who may touch, and that's no one may touch, and a doctor may touch to care for them, or a parent to care for them, but there are appropriate ways. So teaching children early on is very important. Children 4 to 5 years old, they're funny, I think. They're the ones, and I think even 3-year-olds, love to run through the house with no clothes on. So they're all about the free and, just out there. They will say whatever they learn. So if you don't want them to repeat something, it's really important that you not use terms you don't want them to repeat, because they will repeat. At this phase, kids are very curious, and so they're going to play games with others related to their bodies. They are starting to understand the difference between male and female and the gender roles. They're understanding better mom and dad. Mom's a girl and dad's a boy, and those kinds of things. They also understand the genital differences. They also become more aware of their body as they're getting older and may be more modest. Typically at this age, they're not so worried about that. As they get a little bit older, they become more concerned. So children 6 to 8, this is an interesting developmental phase for kids, because they become much more aware of their sexuality, and they tend to separate into gender groups. And so if we look at the schoolyard, the girls are playing over here and the boys are playing over here, and typically those don't cross. They cross when a girl runs up and hits a boy and runs away, and we all know that just means she really likes him. So that's typical in development. They also become very aware of the social taboos that are related to sexuality, and they begin to understand the act of sex. Now again, when we're talking about sexuality and intercourse and those types of things, children at this age don't understand it to that depth, but they are aware of mommy and daddy made a baby somehow. And so they do become more aware. And I think in our society today, things are so explicit in the media that children are learning at a more rapid pace about the acts of sex. So children 9 to 12 years old, they actually become more aware of themselves as a person. And they have more of an identity of who they are, separate from their parents and their friends. This is an age where they're definitely comparing themselves to one another, and they want to know that, am I normal? And, she's really skinny and I'm not so skinny. What's wrong with me? Or she's starting to develop and I'm not. What's wrong? The other part of this is they become very shy about talking about sexuality and sexual behavior. It's very important, and we'll talk more in a little bit about what to do with kids. But as parents, we have to keep the conversation open and keep talking about their development. Kids at this age are definitely understanding statements that are made. So where parents used to get away with making jokes or innuendos, kids are starting to pick those up at this age. So then our 13 and 17-year-olds, they definitely understand that they are sexual beings. Typically at this age, they begin the sexual exploration, and that may or may not include sexual intercourse. But they're trying to figure out just who they are. A part of this is understanding their own sexual orientation. So they may have had thoughts and feelings prior to this that they believe that they're homosexual or lesbian or that they know that they're heterosexual. But during this phase, they really do start to understand and get a good grasp on that. The other part is they understand more clearly that they can get diseases, they can get pregnant, and that there are risks to being sexually involved. Now, that risk doesn't typically stop kids from getting involved because the heat of the moment, they typically don't make great decisions. So we have to prepare them for that. So our children 18 years and older, this is a time our kids are adults, and if they haven't been involved in a relationship prior, they typically enter into an intimate sexual and emotional relationship. They also understand better the issues of commitment and what that means. They are maturing, and so they are adults. Hopefully, they begin to shift their focus from themselves to others. Now, I have 3 grown adult children, and so I keep talking about that frontal lobe development, and when that actually really occurs, I think we'll see more of that shift from themselves to others, but it is part of the typical development. So as we talk about how, as a parent, you're going to teach your child about sexual development and their sexuality, I think it starts with the parent and the caregiver understanding their own sexuality and their own comfort level of how they will teach it. I think it's important to know your own value system and how you will present that to your child. For some people, this is a really hard topic to discuss with your children. But it is so critical that we not ignore it, because ignoring it will not make it go away. Ignoring it may cause our children to make very poor decisions. So as parents are trying to figure out how they're going to start this conversation, I encourage, and we'll talk more about this, is that early intervention, because the earlier you start, the easier it becomes then to continue the conversation. So with our kids with FASD, one of the critical things to think about is a child who may be 14 years old, but developmentally they are still at 9, 10 years old. You have to teach sexuality at 9 or 10 years old. You can't teach it at a 14-year-old age. It's so important for them to understand at the level they are able to comprehend. And so putting those pieces in place will help protect them. Again, we have to remember that they have poor executive functioning, that they, with their compromised cognitive abilities, that they're going to make bad decisions. And so having the external brains in place, teaching sexuality in a way that gives concrete, simplistic guidelines and structure can help children then, when they're in that moment, to hopefully go back to a different decision. That's a lot of work on a parent's part. This is not an easy, we're going to have a 10-minute conversation. This is all the time. And so it's the repetition of talking about how we handle situations. It's a repetition of how we care for one another, remembering what we do. So the early intervention, I believe early intervention is critical. And I believe early intervention can happen a couple different ways. If the child is yours and the child is an infant, you start that early intervention from day one. And so the conversations and the teaching about sexuality and sexual behavior makes it easier then as the child develops and grows. If you adopt a child or a child's in foster care with FASD, you start it then. You start it immediately. But it really truly starts with a relationship. And so as simplistic as that sounds, I believe that children will talk and children will engage with you when they know that they can trust you and that they're cared about. And so that relationship is key in being able then to handle some very difficult situations. Because again, raising a child who has FASD is not easy. And so having those moments where you're building that relationship can help when there could be a critical or a crisis situation. So when we start with early intervention, we teach basic appropriate social skills. Now, in working with parents, this is an interesting concept because many parents think kids just know some things. Well, our kids with FASD, they don't just know things. And so you have to teach the most basic of skills. And I think even with children, you have to do that. So for instance, when a child has a runny nose, we teach our babies how to blow their nose. We teach them how to clean their nose with a Kleenex, not their shirt, not my shirt, a Kleenex. We teach kids how to greet people, say hello to Aunt Patty. Those types of things are important. The same thing applies for sexual development. So we're teaching children the social cues and the social skills of, I don't stand in someone's space. I don't come up and just hug up onto people. I have a boundary about me. But you teach that from day one, and you continue to teach it and continue to teach it. It is a reminder. And so again, in teaching it, doing it with kindness and genuineness and love, not a lecture and not in an angry or embarrassed type of tone, helps children to understand that you're genuinely concerned about them. So it's also important with our teens with FASD to set goals. And the goals need to be what you expect of them, but they also need to be realistic. So if we're setting goals that are so far out there that our children are going to fail, that's not good for anyone. But if we set a goal that, okay, we only go out with a group of people, and when we go, we have these things included. So for instance, we have an external brain that we know of who's going to be a part of that group setting. And we set those goals. I mean, you're going to be home by 10 o'clock, and you make sure that that external brain helps that child get home by 10 o'clock. You have to set the goals and then celebrate the successes so that children feel the good part of that. We don't want this to be punitive. We want them to learn that they can be successful and they can meet some of those goals. A concern of mine with our kids with FASD is that they are at risk for exploitation. And I think the technology in our world today makes this difficult for us. The social media and the smartphones and all those types of things that are out there create situations where kids are really good at accessing things and engaging with people we may not want them to be. And all of that can lead to sexual abuse. And so it is critical as parents that we monitor that and that we're aware of what our children are engaged in and what they are doing. Now, some people think that that is being very strict, to know everything about what your child's doing. I believe that's our role. And I believe as a parent, to protect our kids, especially with FASD, that we have to be involved in everything and do it in a way where it's a relationship that we have built instead of a fight or a battle. So one of the things that I think is critical, and I think this goes for all kids, is you have to know your child's friends. You have to have their numbers, their phone numbers. You have to have the parents' names, their addresses. You have to know them. You have to talk to the parents. Now, your child may really resent the fact that you're talking to their friends' parents. But if you do it in a way where you're building a relationship with them and that it is seen as a positive, it can become another external brain for the child. I think you have to be careful with some information that you give to other parents. You have to definitely trust them to care for that information so that they care for your child. But it's critical in keeping your child safe. It is okay as a parent to tell a child, no, I don't want you to be friends with that child. If you're not comfortable with the way that child acts or what they do or what their parents do, it is okay as a parent to say no. Your child will move on. Now, when you say no, I believe that giving a replacement to that no helps children to actually move away from what you don't want them to do. So the replacement may be that, you're friends with Lisa, and Lisa's a really good influence, and you guys get along really well, and you have fun together. But Joey over here, no, we're going to not spend time alone with Joey. You may say we're not going to spend time at all. That is okay. The other thing that I think that parents can do, and some parents are very uncomfortable with this, but it's doing check-ins. So if your child has gone to spend the day at a friend's house and your teen's hanging out with some kids and they're going to be at a house, that you actually do a check-in. You call and ask to talk to your child, not on their cell phone. You call the house phone so that you actually know they're on the premise. Or you do a drive-by and you come by and you stop in and, hey, just in the neighborhood, just wanted to check in. Again, the way you present it, it may be more accepting than walking in and going, just wanted to make sure you were here. You don't want to offend your child or embarrass your child, but what you want to do is make sure your child's safe. Again, the use of the external brains and making sure your child is where they're supposed to be is critical in making sure that they're safe.
Janae, I find this fascinating, and I just had an example of this, and a parent was asking me for guidelines, and I was kind of floundering, so I'll ask you her question. Her daughter is 19, beautiful girl, but as the mother says, she's got the mind of a 14-year-old. She was adopted at birth. You know, it's the typical story of many of our children. So she's got a 19-year-old daughter with a 19-year-old body and a 14-year-old brain, and she's starting to date. And the mother's question was, how do I ensure that the young man she's going out with is going to be respectful and is going to understand the limits, because she knows her daughter won't be able to set limits?
Wow, that's the million-dollar question. I think because she developmentally is 14, you still have to put guidelines in for that 14-year-old. And so part of what I wanted to talk about was not only talking to your daughter explicitly about your expectations and what needs to happen, but also with the young man so that he understands your goals and your expectations as well. The other part is, as a parent, and I tend to be more conservative with raising children and provide a lot of structure, I would require group dating, and that they not date alone, so that they're not put in those situations where they could make bad decisions. And so that's a tough one, because at 19, she can do what she wants to some extent, but there are other ways to work with your child in having that discussion of, in living in my home, I still have some say. And so I think, again, if you start that relationship early on where you're having those open, honest conversations, you continue to have them. And some of those are very difficult because kids will typically throw a tantrum, even at 14 or 19. And you have to be able to get through the tantrum to still stick to your guns, because you know that's what's safe for your child. So in providing early intervention, and again, that's at whatever age you start spending time with this child, it needs to be simple. You can't give the lecture. Again, I talk about the lecture because I think that's so important. But clear and simple rules about sexuality. Understanding that you always ask permission prior to touching others, and that you know what your personal space is and you know what others' personal space is, and you don't invade that. The other part is teaching kids early on not to talk to strangers or to ask permission before they talk to a stranger. I have a dear friend whose daughter has Down syndrome. And the first time I met her, I was very pleasant with her and said hello, and she would not speak to me. She looked at her mom, and she asked her mom, is she okay? And I thought, wow, that was really good. And this mom had done a very good job of teaching her daughter, just ask me first to make sure it's okay if you talk to them. And so I think we can teach, and again, you have to repeat this over and over, and you use examples of when they might not have asked for permission. And you remind them it's always important to ask. The other thing is teaching and saying it a million times that unprotected sex is never safe. It's not safe from pregnancy, disease, that it is just never, ever safe. So that in the heat of the moment, that hopefully they will remember, because we know most kids don't. And that's not even just kids with FASD. The other part in teaching children about sexuality is about masturbation. Now, this goes back to parents feeling comfortable with their own sexuality and their own value system related to sexual behavior. But masturbation does happen. It is part of growing up and developing. Teaching children and teens where masturbation is appropriate is extremely important. So you set guidelines to masturbation. It is only done in your bathroom. It is only done in your bedroom. It is not done anywhere else, and with anyone else. It is only done in private. Reminding kids about time and place, what's appropriate, helps children then to at least be able to know, okay, I can do this, and I have this place I can do this. Again, having the conversation's important. It's not always comfortable. Sometimes our kids get highly embarrassed, and parents get embarrassed. But the more you can talk about it, the less that becomes an issue. I think as parents, role playing and some of your expectations and behaviors. So if I'm teaching my child how to appropriately hug someone, to show them how to do that, and the difference between hugging mom and the difference between hugging a friend down the street. How do you do that? And so also teaching them even how you ask someone to spend time with them, go out on a date. And again, I am a big believer in group dating because I think it helps so much just to have those external sources around you that can help you make the good decisions. So we have to teach our kids how to say no and what they do when they're in the heat of the moment and they're uncomfortable or they're scared, and that they always know that they can call you or call any external brain in their community of care to come and get them. If kids know that they have a concrete way out, and we've role-played this, and I've done this repeatedly so that they can recall that memory of what I do when I feel like this, hopefully they will give that call and that conversation to an external brain so that they can be protected. Supervising your child has to happen, and supervision looks different for a lot of folks. With a child with FASD, I think supervision, I was laughing with Dr. Chasnoff earlier that it's a parent on steroids. It doesn't mean smothering them with supervision, but it means being able to know that you know where they are, you know who they're with, what they're doing, and that they're not alone. Again, this 19-year-old that Dr. Chasnoff talked about, who is still functioning as a 14-year-old, requires supervision. I wouldn't let my 14-year-old just go anywhere with anyone and do anything. So I have to continue to supervise my 19-year-old in the same way I would my 14-year-old. The community of support, I think, is really important, but I think you have to be careful with the community of support. Engaging the school and people in the school that you trust to know about your child and what your child has been prenatally exposed to can help in creating that external brain outside of your presence. But again, I think you have to be careful because it has to be trusted sources who are going to use that information to help your child, not hurt your child. And so the parent can't be everywhere. The caregiver cannot be everywhere with the child. So the more we engage those people around our child, the better success we'll have. The other part is being involved in the school. As a parent, volunteering, if at all possible, going to school events, you get to know the kids. You get to know your child's friends. You get to know your child's friends' parents. You're sitting in the bleachers together at a game or something. You actually have opportunities to see things that you might not have if you don't become engaged. Again, we're going to talk about supervising. If we are engaging others to be external brains and teaching them how we supervise, that can then help your child with consistency. Again, I keep repeating myself, but I believe strongly that we just have to continue to talk about sexuality openly. We have to put our own angst aside. If we need help with that, then we find someone to help us. If that's a therapist or a clergyman, someone to help us talk to our child about the things they need to know. As we supervise, that's the key word for today, we have to monitor cell phones in our home, and I definitely encourage parents with children with FASD to monitor cell phones. You have to know all the passwords. You have to be able to check text, check email, check internet browsing, and you give very clear guidelines for phone use. One of the rules in our home is if you click out of something when we walk in the room, we're going to take the phone and we're going to search for what you were doing. Because if you're clicking out of things when we're walking in, we're apprehensive that it's something you shouldn't be doing. The same thing applies for the computer. And back to cell phones. Cell phones are never allowed in the bedrooms. And that is a rule that I think can help kids, because if they know they're in a common area using a cell phone, then they have less opportunities to actually engage in something they shouldn't. The same thing with the computer. The computer should be in an open area, a common area. I don't recommend putting them in bedrooms at all. Parental control should be on it, and there should be guidelines. Again, if we're setting goals and setting expectations, not only for sexual behavior, but for how we act in general, we help give children the structure. Some people think structure is rigidness and strictness. That's not what structure is. Structure actually provides a fence around a child to help keep them safe. So interventions for people with FASD transitioning into adulthood are critical. We know from research that substance abuse, high-risk sexual behavior, and illegal activities may emerge or worsen during the young adult developmental phase. And so I think we have to start as early as possible, and we have to do whatever it takes. Again, that is constant. That is not just, for 5 minutes, I'm going to talk to my child one day. It is every day, constantly. One of the things we have to look at is, what do I do? How do I get help? I'm doing everything I can as a parent. And again, it's not an easy job with children with FASD. But one of the things I would encourage is mental health therapy. Now, this is not insight therapy. Children with FASD don't have a terrific ability for insight. And so it is very common sense therapy. It's being engaged of education and role playing. So again, as a parent, if you feel like you have exhausted those means, include a mental health therapist who can help in individual therapy with your child, teaching the things that need to be taught, family therapy and group therapy. I believe the caregiver has to be engaged in the process, though. To just send a child to therapy is not going to help you as the caregiver or help the child in continuing to build that relationship. That is what's going to be key in getting through all those difficult times. So some of the other things that may need to happen are medication support, and that is why I think that a physical examination from a medical doctor is really important, but from a medical doctor who understands FASD. And that's where you have to be very picky in who you're choosing to provide the medical support. You may have to actually engage intensive services, and intensive services could be in the form of multiple therapies a week. So you may have 3 times a week, either in the clinic or even in your home. And oftentimes we'll provide services within the home 3 to 4 times a week so that we can actually be there in the moment that a situation arises, so that we can model for a parent what you may need to do. So you may need to have some type of short-term intensive services. I don't see that as a long-term, but to be able to learn some things that can help support you in the raising of your child. For some kids with FASD, they do need to be placed in a short-term residential care for their own protection. And I see that as rare, but I see that that is necessary in some cases. If you have children who are running away and placing themselves at risk over and over and not able to be maintained within a home, you have to care for them in a way that keeps them safe. And the other part is there are some children who may require psychiatric hospitalization. And again, that's short term, but based on their ability to be safe for themselves or others, you may have to do that. In concluding about caring for kids with FASD and how to help them become healthy sexual beings, I think it's really important, again, that we have supportive relationships, that we build that community around them that is supportive and caring. I believe that the protective factor there is that stable and loving, supportive environment. The single most important factor is a healthy relationship.
Well, thank you, Janae. This has been very helpful for me as a clinician, and I think this is going to be very helpful for folks out there that are working with this population of children.